The tumor microenvironment is a complex system of tumor cells, blood vessels, supportive tissues, and immune cells. Under the process of immune surveillance, the immune system can recognize tumor cells as being foreign and proactively respond by activating and expanding tumor-specific CD8 positive T cells, also known as effector T cells, that are capable of destroying the tumor cells. Normally, the increased activation of the immune system turns on suppressive mechanisms to prevent inflammation from spreading and damaging healthy tissues. These mechanisms include the recruitment of regulatory T cells that block the activity of effector T cells. During an anti-tumor immune response, tumor cells, T cells, and/or myeloid cells in the tumor microenvironment co-opt these natural pathways of immune suppression by secreting chemokines called CCL17 and CCL22 that function as a signal to recruit regulatory T cells from the circulation. When near the tumor, CCL17 and CCL22 bind to the chemokine receptor CCR4 found on the surface of regulatory T cells. This generates a signal that tells regulatory T cells to home in to the tumor. Now in the tumor, regulatory T cells suppress or kill effector T cells and allow the tumor to evade the immune system and grow unchecked. As regulatory T cells die off during the process of suppressing effector T cells, the tumor microenvironment continues to release CCL17 and CCL22, promoting a constant supply of new regulatory T cells from the circulation. This maintains the overall suppressive environment that favors continued growth of the tumor. FLX475, a small molecule compound in development from FLX Bio, is a CCR4 antagonist taken by mouth. FLX475 binds to CCR4, blocking CCL17 and CCL22 from binding. This in turn prevents regulatory T cells from accumulating in the tumor microenvironment, but does not hinder them from functioning normally to prevent inflammation in healthy tissues. Once the flow of regulatory T cells into the tumor microenvironment has been cut off, the balance of effector T cells to regulatory T cells is shifted to favor the anti-tumor response, and the effector T cells are allowed to reactivate and expand once again. Unhindered, the effector T cells can now resume attacking and killing tumor cells, causing the tumor to shrink. Another method of treating cancer using checkpoint inhibitors work primarily by increasing the activation of effector T cells. However, they also increase the production of CCL17 and CCL22 and the recruitment of regulatory T cells. Since FLX475 can block this process, a combination of FLX475 and checkpoint inhibitors should be more efficacious than the use of checkpoint inhibitors alone.